High on these hills, an unexpected kind of peace and quiet. Twice a week, Tibetan Buddhist monks lead a prayer ceremony at the Trizhang Buddhist Institute in Northfield. Geshe Sopa is one of 5 monks who reside here at the monastery.
We are enjoying this place, and all the nature and everything is nice here.
Founded in 2004, the Institute offers visitors modestly priced lodging, meals, and retreats on its 360-acre property. Buddhists the world over know this monastery because of its spiritual director, His Holiness Trizhang Shaktrul Rinpoche. He's considered the 18th reincarnated descendant of Indian and Tibetan Buddhist scholars dating back to the 5th century.
Tibetans call him the Master of Masters. His predecessor was with the Dalai Lama, came out of Tibet in '89, did a lot of scholarly writing, and so he's a revered figure.
Whenever the monks need a doctor, they see Dr. John Matthew.
All of these monks, they all are going to health center and they help us whatever we needed.
What Dr. Matthew has done for the community at large has been transformative in this region of Vermont.
Rural areas have a hard time attracting primary care doctors or keeping them. So the days of the old solo practitioner wore people out. You have to have an organization to attract and retain a staff.
Approximately 85 rural hospitals across the country have closed since 2010, and nearly 700 more are at risk of closing, according to the National Rural Health Association. This uncertainty places an added burden on clinics and health centers.
Vermont has the best overall health care in the nation when people look at all sorts of parameters of health care, in large part attributable to the availability of primary care.
Good morning, the Health Center in Plainfield.
Dr. Matthew founded what's simply known as the Health Center in Plainfield, one of 12 federally qualified health centers in the state. Decades ago, Dr. Matthew was studying endocrinology in Montreal when a chance meeting brought him to Goddard College.
And at some point I said, I'd like to see the community health center. The whole group got quiet. The man who had invited me said, we're kind of hoping you'll start it. And so there was nothing here. And so I didn't really know I'd be here 45 years later.
And you made the transition?
The health center has 5 doctors and 6 physician assistants and nurse practitioners. Their primary care and dental programs treat nearly 8,000 people.
There's a high percentage of elderly in Vermont. There's a higher percentage of poor people in rural areas. If you're worried about gas for your car, you might have a hard time worrying about some change in your diet, for example.
Basal rate.
To help alleviate that kind of stress, the center runs many in-house programs. One of them manages 18 people on diabetic pumps, so they don't have to regularly drive an hour to see an endocrinologist.
We're here 60 hours a week, and that includes 3 hours on Saturday mornings.
Another significant success, this mobile dental van.
We see a good number of kids who otherwise have no access to dental care. They may be able to sign up for Medicaid, which covers kids with dentistry through the age of 20 here, but nobody's helped them sign up. So we help them sign up.
Good work.
The healthcare philosophy here is holistic and includes psychologists, counselors, and social workers. Good, comprehensive care saves more than lives, says Dr. Matthew.
If we're going to solve the national problem of cost of healthcare, we better get primary care practices. They need to be organized like this. You have to get a staff that has multiple hats.
Nationwide, a perpetual challenge is convincing medical students to forego more lucrative careers for primary care.
Everybody comes out of medical school with debt. I think also there's a culture in medical schools that makes people think you only do real medicine if you do specialty medicine. And so there's a culture there that I think, in a sense, disrespects primary care.
What does run in your family?
Dr. Melissa Hauser says there is much to respect about the effectiveness of the health center, which allows staff to care for patients outside of its walls.
Being able to take care of patients and entire families here in the office, the nursing home, home visits, and in the hospital when they're really sick and vulnerable, I think makes a big difference.
We feel privileged to be involved in these people's lives and to be trusted. But if I simply say to somebody, your smoking worries me, it turns out to have an impact. Family doctors have a potential impact that surprises us.
And Dr. Matthews says because residents in Plainfield have such good primary care, they're rarely seen back in the hospitals.
Yeah, they're also taking a real good look at adverse childhood experiences, whether that's abuse or neglect, mental illness in the family, even divorce, because we know that those experiences lead to greater illnesses in adults later in life. So they're hoping to intervene earlier and have better outcomes for those children as they grow older.
Up next, if you can't stand the heat, stay out of the smithy.